As we enter summer, we see environmental changes can have an impact on people's health. Dr. Mary Prunicki joins us. She's the Director of Air Pollution and Health Research at the Sean M. Parker Center for Allergy Research at Stanford. So, Doctor, first of all, thanks for joining us. Can you tell us how environmental challenges are taking a toll on our health?
Sure. The environmental challenges that are going on right now are the biggest threat to our health globally. And there's lots of ways it can impact our health. It decreases our ability to have clean air, safe drinking water, and it impacts our food supply, and also, whether or not we have sufficient shelter for the changes in the environment and increased temperatures. Of course, climate change is associated with heat waves, which causes increased deaths, but there's also a lot of other direct and indirect implications, such as air pollution. We know that 90% of the population globally is not able to breathe clean air. Wildfires obviously contribute a lot to that air pollution problem. And then pollen season is changing and causing a lot of health problems. There's changes in vector-borne illnesses, and of course, mental health is something that shouldn't be overlooked.
And you mentioned wildfire season, and we have mentioned this before, that we've seen those apocalyptic images of the smoke just coming into the United States. A lot of that's coming in from Canada. What is the impact that's having on people in the United States right now?
Right. So we know that breathing the smoke can have both acute and chronic health impacts. Acutely, it can cause respiratory problems, especially in the very young and very old, and those with pre-existing conditions like asthma or COPD. It can cause problems with your heart, so cardiac problems, so things like heart attacks increase when people breathe the smoke, arrhythmias, and even things like stroke increase when those at risk breathe the smoke. So there's many health implications. And another group is pregnant women, the babies. Their own babies can have health implications from them breathing the smoke.
And what's being done to counteract these negative impacts?
Well, they're trying to tackle it in many different ways. One is through research, is what we do. Another is through policy change. Also, things that can decrease the amount of emissions we're putting into the air. So tackling wildfires and trying to help mitigate some of those impacts, and regulations to decrease the amount of pollutants we're putting into the air from other sources, such as vehicular traffic and other types of pollutants.
How hopeful are you that we can actually reverse some of the impacts of climate change?
Well, I know it's possible, and I hope that we're able to do so, because our health is already impacted by it. And the longer that we go on, the harder it's going to be to kind of mitigate and counteract those impacts. And, the most vulnerable populations are the most at risk from these impacts of climate change. So for especially those populations, I hope that we can, not only as a nation, but as globally, address these issues for better health for everyone.
And climate change has also led to climate anxiety. First of all, can you explain what that is, and what advice do you have for anyone that might be dealing with it?
Right. So climate anxiety, or it's also called eco-anxiety or climate doom, it is something that people are seeing in about 10% of the population, and it tends to occur in people who are already tending to be more anxious about other things. But, it is something that needs to be addressed. And one type of solution that has been suggested for people with climate anxiety is to get involved and, as a group, get involved themselves in activities that help mitigate the impacts of climate change, so that, one, they have a social support, which is a good predictor of mental well-being, but also they are actively combating the source of the anxiety.
All right, well, always good information. So, Dr. Prunicki, thank you very much for joining us.